Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Flail chest: what causes it and how to treat it? Flail chest occurs when at least 3 ribs are broken in 2 or more places. Instead of rigidly holding the normal shape of the chest, as the rib cage is meant to do, flail chest results in a segment of the chest wall flailing back and forth in the opposite direction of the rest of the chest wall. /r/n/r/n Flail chest is usually caused by a very serious accident, such as a motor vehicle crash. This is a dangerous injury to the ribs that requires emergency medical treatment. Left untreated, flail chest can lead to long-term disability or death. /r/n/r/n This article looks at the symptoms and causes of flail chest. It also explains how the condition is diagnosed and treated. /r/n/r/n Signs and symptoms of flail chest after a traumatic injury include /r/n/r/n bruising, inflammation, and sensitivity in the injured area are also expected. /r/n/r/n On physical examination, a person with a flail chest may present with decreased breath sounds and/or crepitus, a grinding or crackling sound. /r/n/r/n Flail chest is typically a result of major blunt trauma to the chest wall. The most common causes of flail chest are direct blows to the chest, car accidents, and falls from high heights. /r/n/r/n Rarely, flail chest is due to weak bones or bone disease. /r/n/r/n Flail chest is typically diagnosed during an extensive physical evaluation after a traumatic injury. From there, 1 or more chest X-rays may be done to fully examine the chest area. In addition to looking for broken ribs, other signs your provider may look for include punctured blood vessels or bruises on the lungs. /r/n/r/n Medical professionals will monitor for changes in breathing that could be a sign of respiratory failure from flail chest. /r/n/r/n Flail chest is a medical emergency. While this can be a life-threatening condition, there are ways to mitigate the damage if you believe someone has flail chest. /r/n/r/n If you are not the injured person, practice universal precautions and wear personal protective equipment, if available. Be sure that whatever caused the injury is no longer a threat to them or you. /r/n/r/n If the 911 operator gives instructions, follow those instructions and ignore the remainder of the steps outlined here. If you cannot call 911, get the injured person to emergency medical help as soon as possible. /r/n/r/n Use a pillow to put pressure on the flail segment. Holding the flail segment in place keeps it from moving in the opposite direction of the surrounding muscle and bone. Stabilizing the area will reduce the chances of damage to the heart, lungs, and surrounding tissues. /r/n/r/n If a pillow is not available, almost anything soft will do. Roll up a jacket or a blanket. If there is absolutely nothing available, have the patient lie on the affected side of the chest to discourage it from moving. /r/n/r/n While you may be able to help stabilize a flail chest, it is critical that this injury receives emergency medical treatment. Even if the pain has subsided, failure to provide proper treatment for flail chest can lead to pneumonia and other life-threatening conditions, including a collapsed lung or blood around the heart. /r/n/r/n Regardless of how a flail chest is treated, it is going to hurt probably worse than anything you or the injured individual has ever encountered. Over-the-counter pain medications aren't going to do much for this level of pain, and stronger painkillers aren't a good idea until emergency medical help is available to provide the full range of emergency treatment. /r/n/r/n Try to remain as calm as possible and provide assurance that help is on the way. /r/n/r/n Emergency medical treatment will first involve the delivery of oxygen, usually through a face mask. Intubation and mechanical ventilation will likely be used for those presenting with lung damage related to flail chest. as well as those who doctors worry will experience a chest cavity collapse. /r/n/r/n surgery may be required, but the decision for this will be based on an individual's case and how stable they are. /r/n/r/n pain control is essential, which may involve an epidural and opioids, though the latter must be carefully prescribed due to the risk of inducing further respiratory concerns in some people. /r/n/r/n flail chest occurs when at least 3 ribs are broken in 2 or more places, causing a segment of the rib cage to become unattached from the chest wall. This condition is considered a medical emergency. Paradoxical movement, in which a segment of the ribs moves against the normal breathing pattern of the chest, is characteristic of flail chest. There will also be severe pain and possibly difficulty breathing. /r/n/r/n if you or someone you are with may have flail chest, call 911 immediately. Depending on the injured person's condition, emergency surgery may be necessary. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.